Hey, Dr. Shoshana here. I'm here with Diana. She's a new patient. Interestingly enough, she watched me on YouTube at 3 o'clock last night. 3 o'clock in the morning, and someone spoke to her that she needed to be here. So she walked into our clinic in Manhattan. She's here today. Never been to a chiropractor.
Never.
5 years of back pain ever since she had a baby, and fell when she was 8 months pregnant, and she's been getting painful injections that really haven't been solving the problem. So today what we did is we did an examination. We found that she had difficulty with the way gravity was dealing with her. She had postural distortion. So I don't know if we can pick this up on the camera, but the green line is the center of gravity. Red is where she falls amongst the center of gravity. So she's listed or leaning to the left, and most of her symptoms are right in her mid to low back area. So what we're gonna do is we did some orthopedic tests, we took some reflexes. She's a great candidate for chiropractic care. She probably should have done this before all those injections. Right?
Yeah.
So now what we're gonna do is we'll take 2 x-rays of your lower back to see what's going on, take an image of your neck, and then we're gonna come back in here and do the adjustment. But I wanted to do a whole video of what it looks like when people come in, how we find what's going on, and then we do the adjustment, okay?
Great, yeah.
All right, so come back here for 4 minutes today. So any surgical implants? Yeah, no pacemaker specifically. Excellent. So I'm going to go ahead and set you up in here, and then I'm going to step out and take an image, okay? And then what you're going to do is I'm just going to have you stand here, stand still, stand normal, breathe normal. We're going to be doing things special, okay? Suppose with digital imaging we can see right away. Change the exposure a little bit. All right, you can come on out now. Don't forget the beats. All right, so I'm going to go over some initial radiographic findings here, and then I'll do an actual full evaluation later. But I just want you to see what I'm seeing at first, okay? So when we look at, this is the front to back, right? This is your right side, this is your left side. What I'm primarily looking for are any degenerative changes. We've got some minor degenerative changes down here, L4, L5, as this connects, okay? This tends to happen with age and activity, but also pain, right? So you had a fall, we don't know how that's connected, but especially after pregnancy, there's a lot of changes that can happen with the hormone relaxing, right? Everything like that, plus just the stress of carrying a child, okay? So then we look at the side view here, okay? So what I'm primarily seeing right off the rip is some reduction in disc space at a few of these levels, okay? So this would be a healthy disc space, this would be a healthy disc space. But up here we can see a reduction, and down here we can see a reduction. Okay, you see how it's more difficult for the cursor to fit? Yeah. So what that can mean is a few different things. It could mean your disc is dehydrated, which happens over time and with age, but it also could mean that disc is now bulging posterior, right? So when the disc bulges posterior, what can happen is this, okay? So
lay on your back, and the top of your hip should be below this metal bar, so maybe slide down a little bit. So as you can see in the x-rays that Dr. Austin took, there's a lot of pressure that you've been carrying in your lower back and your neck for a long time. So much so that some of the bones have even changed shape. So this move, like I said, people flying from other countries to get this done by doctors that were trained by Dr. Johnson. It's a hell of a move. Today at 11 o'clock, I have a patient coming in for a second visit from Istanbul. So that's pretty damn far. You know, a lot of doctors, it's good.
Wow.
All right, so take a deep breath in. Just relax, don't help me. I want this to go in, breathe in, and let it all the way out, out, out. Tight, right? Okay, try sliding up towards your head. I want you to try sliding up. Not so much, right? Okay, so the trick is you're gonna keep your teeth together. You're gonna keep breathing in and out through the nose. Okay. And the trick is, we'd like to get in here, pick your head up for me. Okay, good. Rest your head down, rest it down. Okay, good. right at the base of your head. Put your head down, don't fight. Just drop this down. All right, for the viewers out there, it's not supposed to be choking in the neck. All right, so take a nice deep breath in. Good, breathe in. And all the way out. Out, let your air out, good. And wiggle your right big toe. Wiggle it, your toe. Okay, good, good, good. Breathe, breathe, breathe,
Nice
breathe.
deep breaths.
Breathe, breathe. Scary, right? Okay, good, good, good. Breathe, breathe, breathe,
Nice
breathe.
deep breaths.
Breathe, breathe. Scary, right? But you okay now? Okay, breathe, breathe. Good. Take a breath. Just breathe, breathe, breathe. Where do you feel that release? The hold down the spine?
I feel, yeah.
Told you it was going to be an emotional one. I knew it as soon as she came in. There was a lot of emotions that trapped up in there. Okay, good. Breathe in. You ready for me to do the rest, or you want to take out your breath? Good. Did that hurt or just? And this is the easy part. The rest is easy. Don't howl. 2, 3, 4. Drop this. Wiggle your toes. Drop this. That didn't hurt. That didn't hurt. Now everything else is easy from here. You're a pro at this. Drop your head down. No problem. Okay. Now, there's no rush here. Okay, you're gonna turn on your side, facing the window slowly. Turn on your side. Okay, and then push yourself up to a seated position. Push yourself up. Good. Sit up straight. Okay, good. Now, stand up. And what's different so far?
I feel a lot lighter.
I didn't put words in her mouth.
I feel like 100 pounds off my back.
Okay. Ring dinger takes a tremendous amount of pressure off the spine. Now we're going to do the rest of your spine, okay?
I'm asthmatic and I can breathe a lot better.
Absolutely. So we're taking pressure off your nervous system. You're going to go home. Today's going to be an amazing night of sleep. You're going to be sore from that
Thank you
adjustment.
so much.
You're welcome. That's why I'm here.
Wow.
Well, I was right. Emotional.
Yeah.
Let's go face down. I'm going to adjust the rest of your spine now.
I've been taking so much meds and so much shit and nothing works. I thought I was gonna live my life like this. I
No.
thought there was nothing.
There's a time and place for medication, but for when it comes to back and neck, it's overprescribed. There's a reason why people just taking meds way too much. So we start with chiropractic care.
And then I'm dependent to that.
Yeah.
I can't even pay my daughter.
It's not a good idea. Let's do the rest of you. Let's go face down. Side, right side. So what we're going to do now is we're going to adjust the rest of your spine. This is definitely not as loud. You're going to feel the table pop up and pop down, okay? This doesn't hurt. Shouldn't hurt. Good. After the ring dinger, everything is easy, right? Good. All right, this is the big one. I want you to breathe in and bend your knees. Bend both your knees, keep on going again. Good, put them down. Was that terrible?
No.
Okay, so this is all new. So she's never been to a chiropractor. 5 years of back pain. Take a deep breath in, stretch, down. Got it. Let your air out, wiggle those toes, drop this like that. Good, got it. Flip over, lay on your back. So what's interesting is how she found us, YouTube. And now we're going to put you back on YouTube. And the viewers out there, you can see she's crying, not because it hurts, because it's...
I just can't believe that I went 5 years and I didn't know about you.
Well, it's not just me, it's chiropractors around there. There's more than just me as a chiropractor. Chiropractors are everywhere. Breathe in and let it out. Drop this. Good. Good. Just trying to unload. Good. Relax his knee, elbows. Just relax. Drop this. Good. There we go. All right. Now, again, turn on your side, facing this way. Turn on your side, and then sit up. Okay. Stand up. And I want you to capture that. So tell me what's different. Tell the camera, not me. I know what's different.
I can move better.
You can move better.
Yeah. And it's a lot lighter. And I don't feel the stiffness that I had.
Isn't that wild?
Oh my God.
Isn't that wild? Because now we're going to do the instrument part. Okay, so let me show you what this does, because you've never had anything. So turn around. This is the instrument. It's doesn't hurt, but I'm going to be working in the areas in the back that are the most restricted. So stand up straight, facing that way. Okay, good. So take your hands out like this. Bring your head upright. Bring the shoulders back and chest. So this is a neuromechanical adjustment. You have a lot of nerve endings in your body called proprioceptors, which are responsible for joint awareness. So it's stimulating those mechano/proprioceptors. Doesn't hurt, right?
It's just tenderness I have.
Well, you're gonna be tender. I said you've been like this for a long time. Right there. Good. All right. So tell me again, what's different? You feel better than when you walked in?
Lighter. I feel like a lot of my, I feel like 100 pounds just went off of my back. That's how I feel right now. And I feel I can move a lot better and I can breathe a lot better.
It's a good option. So chiropractic's a good option. So that's what I want to document is that first adjustment. We look at your posture, we looked at the way you moved, we look at x-rays, we determined you're an excellent candidate for it. Went ahead and did that vigorous adjustment. I'm not gonna lie, that was heavy duty, right?
Yeah, yeah.
And you felt that release all the way down? So
Yes.
your homework tonight, ice your neck, ice your back, sleep, lots of water, and we'll probably do a follow-up. Today's only Monday, probably like later in the week or Wednesday or Thursday. We'll do this a couple of times and you don't need medication for this kind of stuff. All right?
Thank you.
Happy?
Oh my God, thank
Okay,
you so
good.
much.
You're welcome.